Do you know the most appropriate time to ice versus the most appropriate time to put heat on any area of your body? That's a huge thing. I even see it messed up at hospitals all the time after injuries and accidents with individuals. So here's how it breaks down. Whenever you have an injury or something that flares up really bad, during the first 72 hours or 3 days, that is when you want to be applying ice. And the most appropriate way to apply ice is to get ice pack, frozen bag of peas, vegetables, anything you have in your freezer, so long as it's frozen. Wrap just a paper towel around it so it's a super thin barrier, and then apply it directly over to that area. And you can leave it on for about 15 to 20 minutes. Certainly when you take that off, your skin should be numb, you shouldn't feel anything. And then if you do want to reapply it to the same area, you have to at least wait 60 minutes and let it warm back up to normal body temperature before you reapply. If you don't, you actually can stimulate inflammation, which is the opposite effect you're going for. So that's ice. Heat would be more appropriate if you have a non-traumatic issue going on, you got increased muscle tension, a chronic problem. A chronic problem is defined as something you've had for at least several weeks or months or years in nature. In that instance, you want to apply heat to the area. More than a paper towel though, you want a terry cloth towel or something thicker between you and the heat so it's more of a gentle heat. Moist heat is better than dry heat, so using the electric heating blankets or pads and things like that are not good ideas. So clay packs, gel packs, anything that has some moisture in it is definitely better for you. And you apply that for about 10, 15 minutes back, but I kind of like to keep it more simplified at about 10 minutes, once per hour on that area, and reapply. The only difference, you can do contrast therapy. Contrast would be applying heat to the area for about 10 minutes or so with the towel in between to get blood into the area, and then applying ice when you're done with that to control any secondary inflammation from the heat. That can be done in some instances as well. Or if you have a chronic problem and you flare it up by something physically you did, then I would dedicate more ice to that area in that circumstance as well. So hope this paints a little bit more of a clear picture for everybody out there on when the appropriate times to apply heat versus ice is going to be, because that can be the difference between getting a good benefit or having it flare you up and making things worse.